Hey, this is Daniela from the Obstacle Doc, and today we're going to talk about neural tension, specifically in the upper extremities, being your median nerve, your radial nerve, and your ulnar nerve. So, a lot of the times when people come to us, they might be presented with vague symptoms. Usually, we experience these in either sustained positions, whether it's sitting, if you're breastfeeding, holding a baby, maybe here, or also positions of extension. So if you're kind of reaching behind your back in your car, kind of going for something in the back seat, um, they can be described as tingly sensations, maybe numbness, prickly, sharp, anything that kind of feels like it's coming from the central spine and coming out down to the fingertips. Things that we do try to differentiate in the clinic is, I know commonly carpal tunnel, people will come to us nervous about carpal tunnel, um, or any kind of other impingement on the spine. So this is, again, vague that we can tease out into neural tension. When we say neural tension, what we mean is that the nerve, as it runs through the body, is coming from the spine all the way out to the fingertips. Along that pathway, it's weaving in and out of muscles, around bones, structures, and anywhere along that path, it can kind of get wound up. So depending on if it's a muscle that's kind of tightening down on that nerve, or if there's some restriction of movement and all of a sudden you go to reach and you get that pang of pain, that could be from some neural tension. So when we talk about a home exercise program for neural tension, we like to call it neural flossing. So if you think of maybe that, door hinge or a piece of floss is the nerve, you're kind of teasing the nerve from one end to the other so that it gets a little bit loosened up, and then it's easier to reach across the span of what it's capable of. So for Christopher here, if he is reaching out his right hand all the way to the side. So if he's experiencing any neural tension along the shoulder or through the elbow or down to the hand, we can do for the median nerve a very specific neural tension, neural flossing maneuver. So for this one, you are going to externally rotate. So if he's here, he's going to externally rotate the shoulder. So now we've wound up the tissue here. He's then going to extend his elbow. He would then extend his wrist. And then finally, he would take his ear to his left side. So he's going to open the space here. Now what this does, this has wound up all the tissue that's running along the median nerve and taken it into a place of tension. This is the longest that nerve's going to be. And the reason that we can identify, the way that it is neural tension is because if he were to move his head back, or if he keeps his head there but bends his wrist, any of those giving some slack to the tension, to the tissue, would be relieving. So putting it back into its place of full tension, that's going to be maybe the most aggravated that nerve would be. So if you are experiencing symptoms anywhere along this chain, we can pull back to the start. So if external rotation and a little bit of elbow extension is as far as he can get without being uncomfortable, that's as far as we're going to go for a couple of repetitions. So he would come back in and maybe just come back out into that degree of extension that is comfortable for that nerve, for that neural tension. If he's able to finally break through, he could then either try the wrist, maybe just extending the wrist is enough, or he could also keep the wrist still and try to move from the neck. So again, breaking past the discomfort point, then you can start to add the distant aspect of the nerve. So if you're feeling any kind of neural tension through the median nerve, you're probably going to get sensations around the thumb and through the first two digits here. That's common for median nerve. For ulnar nerve, you might experience some tingling through the medial side of your elbow down to the forearm and into the pinky and your ring finger. So the way that we can start this is extending all the way out. So this is the most slack that the tissue is going to get for the ulnar nerve. And then you can start by making an OK sign. This is going to end up looking like, when little kids make goofy signs of L's. So we're making our OK sign. And then this might just be enough for some people. The second step is going to be to bend the elbow, and you're still keeping that okay sign, and you're kind of flipping it in. The last piece would be getting the I over the O and getting your 3 fingers flush with the side of your face. So anywhere along this cadence, if you're getting any of those symptoms through the pinky, through the ring finger, that is when you would stop. So if Christopher comes all the way back out, and if he's experiencing symptoms when he gets to here, that's as far as he's going to go. He's going to work his way through this region until this feels more comfortable, and then he can progress. So for the radial nerve, if you're experiencing any neural tension here, you're going to feel something potentially on the back of the hand rather than the front. So again, the front is going to be median, ulnar, and then radial will be on the back. So for this one, you're actually going to start with your arm at your side, and Christopher's going to have his arm relaxed. The first step is going to be to internally rotate the arm. So you're going to take your elbow pit, point it towards the back, and then you're going to gently extend back behind you and take that wrist, the hand's going to make a fist, and then you're going to try to pull up as far as you can go. And then the last step for the arm is going to be to drop your wrist down into flexion. So now this is on a full tension, and then he can also take the head out to the side. So again, at any point through this motion, he can either bring the head back, take the wrist out, come just up to wherever he's experiencing his symptoms, work through that motion, and then progress as he can. So if you're experiencing any of these maybe neural tension symptoms, tingling, numbness, things coming up and down the arm, there are tests that we do in the clinic as your therapist to distinguish if it is median, ulnar, or radial nerve. That is a test that will look similar to what the exercise we just showed. However, again, that's something that we can differentiate here with you first before we give you out a specific flossing mechanism.